Hi everyone, my name is Dr. Zarana Swarup and I am a general pediatrician at the Children's Hospital of Philadelphia. I'm here today to talk to you about becoming a general pediatrician. So first, I'm at home, don't worry, not around anyone, so I'm going to take off some of my protective equipment here and just talk to you about what it takes to becoming a pediatrician. So first thing I'll tell you about is what a general pediatrician is. So my job involves taking care of kids. So I get to take care of them from the moment that they're born to when they become an adult. So anywhere from 0 days old to being somewhere between 18 to 21 years old. So it's a pretty amazing job that I get to follow kids and watch them grow up from when they were little. So the things that we do are take care of everyone when they're healthy or when they're sick. So if you've ever been to the doctor once a year or for your checkup, you know how that works. So we like to see you at your checkups, make sure that you're growing well, that you're healthy, you're sleeping well, you're doing well in school, then really generally that you're happy and you're healthy. The cool thing about my job is I get to see you again as you're growing up and get to know your family really, really well, hopefully with time. So that's really exciting. The things that I go over at your checkup are what I mentioned, and a lot of it goes over just kind of giving you guys advice on different things. So when this happens, what do you do? If your baby's not sleeping, how do you work with them to sleep? How do you introduce foods? Or when you're dealing with bullying in school, what do you do? So it's a neat job to have. The other thing that I mentioned is that I get to work with kids when they're sick. So one of the neat parts is kind of using my brain to diagnose what's going on and to help figure out how to take care of it. So for example, I have a sore throat and I have a fever. What do you do? Well, it could be a lot of different things. It could be strep throat, it could be mono, it could be COVID. So lots of different things that we have to think about and factor in. So to learn all of that, we get to go to school. So let me tell you about my journey to becoming a pediatrician. So first thing, just like you guys, I went through normal school. So going through from kindergarten to 12th grade. When I was in high school, I spent a lot of time making sure that I was involved in lots of activities. So while I wasn't an athlete, really, I didn't do that. I spent most of my time involved in clubs and activities, but really you can do anything that you wanted. So a lot of that was spent volunteering, so making sure that I was out and about in the community and doing things that I loved and helping others. And that helped make an easy transition as I applied to college. So in college, you get to spend a lot of time just learning about a lot of things. You can major in anything that you wanted. So traditionally, lots of people say you have to be a pre-med major. And well, I was. But you don't have to be. You can study business and get your pre-med requirements. You can study archaeology and get your pre-med requirements. So really anything that interests you is doable as long as you get those requirements. And what that means is making sure that you're taking the right amount of science classes and math classes that help set you up for studying afterwards. So after you finish your undergraduate career, then you take some tests called the MCATs to apply for medical college. And then medical school is 4 years of school. So it's a decent amount of work, a couple of years where you're studying super duper hard, and then a couple of years where you're studying as well as getting to see patients with different physicians so that you get some supervision. After you finish up medical school, then you get to go to residency. So residency is the time when you're already a full-fledged doctor or physician. In that time period, you get to train and do everything that you've been practicing and learning about with the supervision of someone called an attending. An attending is a physician who's been practicing already and will supervise and make sure everything that you're doing is correct. To become a general pediatrician, you do 3 years of residency. And then afterwards you can practice. So what I did was finish up those 3 years, and then I took my job where I am now at the Children's Hospital out in Bryn Mawr, so part of the community right here, and started back at work. So again, like I mentioned, doing medicine is like one of the coolest jobs in the world because I get to work with kids, see them grow up, work to teach them, work to teach their parents and make sure that everyone stays happy and healthy. And then some of the side things I get to do are neat too. As part of my job, I get to volunteer sometimes to work with medical students to teach them and work with residents as well to teach them. So not only do I get to help diagnose and treat patients, I get to help teach and make sure that the community grows so that we kind of stay and have a good, healthy group of people who are rising to become pediatricians as well. So if you guys ever have any questions, feel free to reach out. Take care. Bye-bye.